This video covers anatomical terminology, specifically the planes and axes of the human body. This foundation is essential for anatomy, radiology, and biomechanics, and will frequently appear in clinical questions, even if not explicitly asked. Our learning objectives are to clearly define anatomical planes and axes, identify them on various diagrams and medical imaging, apply this knowledge to describe movements and clinical scenarios, and confidently answer USMLE-style questions. Planes and axes matter greatly. In radiology, they are essential for interpreting CT and MRI slices to localize lesions. In clinical practice, they are crucial for describing surgical approaches and joint movements. This terminology is frequently tested indirectly on the USMLE. All anatomical descriptions are based on the standard anatomical position, regardless of the patient's actual posture. This position is standing upright, face forward, upper limbs by the side, palms facing forward, and feet pointing forward. An anatomical plane is an imaginary flat surface used to divide the body into sections, describe locations, and interpret imaging. The three principal planes are sagittal, coronal, also known as frontal, and transverse, also known as horizontal. The sagittal plane runs anteroposteriorly, dividing the body into right and left parts. A median or mid-sagittal plane creates equal halves. A parasagittal plane is parallel to the midline, creating unequal halves. Midline brain structures are best viewed in the mid-sagittal plane. In clinical correlation, the sagittal plane is important for visualizing herniated intervertebral discs and evaluating spinal curvature. Movements associated with this plane are flexion and extension, which occur around a transverse axis. The coronal or frontal plane runs side to side, dividing the body into anterior front and posterior back parts. It is commonly applied in chest imaging, facial anatomy assessments, and shoulder abduction studies. Coronal plane clinical scenarios include paranasal sinus CTs and localization of facial nerve lesions. The associated movements are abduction and adduction, which occur around an anteroposterior axis. The transverse or horizontal plane runs horizontally, dividing the body into superior upper and inferior lower parts. This is the most important plane for radiology interpretation, as standard CT scans are viewed as axial slices. Clinical scenarios for the transverse plane include CT brain for stroke localization and determining spinal cord injury levels. The associated movement is rotation, which occurs around a vertical axis. To summarize the anatomical planes, sagittal is anteroposterior, dividing right and left with flexion/extension movements. Coronal is side to side, dividing anterior and posterior with abduction/adduction movements. Transverse is horizontal, dividing superior and inferior with rotation movements. Anatomical axes are the pivot points of movement. An axis is a line around which a plane of movement occurs. The key rule is that the plane and the axis are always perpendicular to each other. The three types of axes are the transverse axis, which runs left to right and is perpendicular to the sagittal plane. The anteroposterior axis runs front to back, perpendicular to the coronal plane. The vertical axis runs up and down, perpendicular to the transverse plane. The transverse axis runs left to right, acting like a hinge pin through a joint. It is perpendicular to the sagittal plane and facilitates movements of flexion and extension. The anteroposterior axis runs front to back, perpendicular to the coronal plane. This axis allows for abduction, moving away from the midline, and adduction, moving towards the midline. The vertical or longitudinal axis runs up and down through the center of the body. It is perpendicular to the transverse plane and facilitates movements like rotation, pronation, and supination. This table is high yield for the USMLE. Remember, flexion and extension occur in the sagittal plane around a transverse axis. Abduction and adduction occur in the coronal plane around an anteroposterior axis. Rotation occurs in the transverse plane around a vertical axis. Here is a USMLE-style question. A radiologist is reviewing a CT scan that shows a slice through the brainstem, dividing it into superior and inferior portions. Which anatomical plane is this? The correct answer is transverse, as it divides the body into superior and inferior parts. To avoid common mistakes, always ask how the body is divided to identify the plane, and what movement is occurring to identify the axis. Remember that an axial scan usually means a transverse plane. In summary, planes divide the body, and axes are perpendicular to planes, allowing joints to rotate. Clinical mastery of planes simplifies radiology, while mastery of axes simplifies orthopedics.